this will be quite quick, and what I want to do is just sort of give an overview of where the Doorway program is. Sean, I thought Sean was going to be here, but he's not here. So Jean, if I say something really wrong, will you please grab me by the throat? And there'll be a slide at the end that I want to focus most of our attention on. The Doorway program is a program that is funded by the State Opioid Response. These are federal SAMHSA dollars, approximately 40 million coming in over a 2-year period of time to the state, going to multiple different programs that are overseen by the State Opioid Response Group in New Hampshire dollars. The purpose of these funds is to improve our care, reduce harm from the opioid use epidemic that we're living through. One of the programs is called the Doorway program, or formerly known as Hub and Spoke. And as you recall, back in the fall, the governor said, I would like it so that anyone in the state of New Hampshire doesn't have to travel more than 1 hour to get help. And the plan that was created were 9 hubs or doorways in the state of New Hampshire, so that those doorways would be able to bring people in and do an assessment and get them connected to the right resources. So what you have here is statewide data about what's happened since these doorways went live in January 19. And for all the criticisms we might have about the Doorway program, and there are plenty of criticisms, I gotta tell you, I have never seen such mobilization of resource and willingness in people. When you think about, what was it, October, that we really kind of launched the planning for the Doorway, and the doorways actually opened on January 1st. January 1st. We even tried to plea with the state, can you make it January 2nd? Because January 1st is a holiday. Who wants to start a whole brand new program on January 1st? And they said, nope, January 1st, you need to start. There have been bumps along the way. There continue to be bumps. Many of you will sit here and go, I haven't even heard of the Doorway. That's been on purpose. The state has said, let's start with a soft launch so that we don't have an overwhelming demand that we can't meet. But honestly, things have really progressed. I'm looking at all the Doorway people around. I think things have progressed in a way that I'm actually astonished at how well things have moved along. I'm not going to read this off to you, but you can see that the calls from 2211, 592, clinical evaluations, 631, et cetera, et cetera. And these are statewide data. Go to the next slide. So what does the Doorway do? The core services of the Doorway are open the door, bring you in, assessment, referral to the right services. And there's a telephone screening and stabilization, diagnostic evaluations, care planning, case management, continuous recovery monitoring. This GEPRA is a very, very long comprehensive assessment similar to our CCSA, Comprehensive Core Standardized Assessment. Not exactly the same, of course, but similar, with the idea that we're going to assess you for medical, mental, and physical and social determinants of health and other behavioral risks. And then naloxone distribution, which has been shifting from the regional public health networks to the Doorway as the main distributor. The Cheshire Medical Center really started, this one says January 2nd after I just said January 1st, because the on-call service started on January 1st. The Cheshire Medical Center, and Sean LaFrance was just a hero, as well as the other folks down in Cheshire who made this happen starting on January 2nd. It's been open. They've now hired 4 experienced staff members. They've seen 89 clinic clients in their first quarter, And in the month of April, 28 new clients. So you can see how volumes are ramping up. The doorway at Dartmouth Hitchcock, Lebanon, which is located in the addiction treatment program. You've heard ATP or River Mill complex, is a little bit different than the other doorways in the state because that was an existing addiction treatment program. So the doorway in Lebanon does exactly the same thing as the doorway at Cheshire and the other doorways, but it can also provide these additional services. It makes it a little bit confusing for the community, right? Because now I go to this doorway at Lebanon and I can actually get services. I can actually get started with MAT and get services, but the other doorways, I don't have that MAT right at the doorway. Some of the doorways are starting to initiate that. Be that as it is, just think of all the doorways as open the door and I can start my process of seeking care. This is data from the doorway at Dartmouth Hitchcock, 63 new evaluations. Interestingly, although this has 57% opioid use disorder, when we look at the calls that come in, about half and half, correct me if I'm wrong, I'm looking at my doorway folks, about half and half, Megan, half and half alcohol and opioid use. No one's surprised by that. This really is designed for the doorway program for the opioid use disorders and diseases that we're seeing. But people aren't getting turned away. They're being assessed and treated for other substances as well. And I just want to also add, we talk about alcohol, and I really am starting a big push on making sure we continue to think about tobacco as one of these substances in terms of medical cost and harm. Tobacco probably outstrips every other substance around. So let's think about these as bundles of substances. Yes, they have different treatment interventions, but if we can bundle them and think of them together instead of separate silos of need and care. So I just want to end on this slide. This is 3 maps of the state of New Hampshire, which is what we've got 1.3 million people, so not a lot of people. And we're slicing and dicing in a whole lot of different ways. Your first map on the left is us here, IDN Region 1, but we've got 7 regions throughout the state of New Hampshire doing similar work and working to serve a similar population, the Medicaid population. I just want to remind us, in 2016 when we met in that room, we said, while this is being funded for Medicaid, we are building an infrastructure that will take care of all patients with need. And both Jose Montero and I think, stood hand in hand. No, not quite hand in hand. But the idea is we're going to build the system that takes care of all patients in need, not just Medicaid. But we're funded for Medicaid, so we've got to get that done. The next are the regional public health networks. We've got Eileen and Alice, members of all of these both of these maps here. 13 regional public health networks with many of our staff members working across these programs, and a lot of work on prevention and supportive recovery through the regional public health networks. And the last map is the doorway program. That's what I was just giving a summary on, 9 doorways. Our challenge, I think, is to make sure we are smart across all 3 of these maps. I think it would be sheer folly for us to think, oh, we're going to build a good IDN and a good regional public health network and a good regional doorway program, and never the 3 shall meet. We don't have enough resources in this state to do that. So we're really pushing. Jess and I go to lots and lots of meetings in Concord, really, really pushing on how do we think about this across these 3 maps? What's the IT infrastructure to, when a patient has a need for housing, for food, that we are able to create a single consolidated coordinated referral system. I don't care if the referral starts from ATP or starts from the primary care office or starts from one of the community-based organizations working with the regional public health network. We've got to make this inescapably easy to do the right thing for our patients. These are complex diseases that are really hard. Even if you had a PhD, it'd be hard to navigate through this, let alone someone whose life is in crisis and their family and friends are stepping away because they've been hurt so many times, they've lost their job. It is up to us, I think, in this room to make sure that we keep all of these maps in sync and coordinated, and that we really dissolve the boundaries between the regional public health networks, the doorways, and the IDN. That's what I'm hoping for us to work to as we think about sustainability and the work ahead of us in the next year and a half of this program. So thank you, and I can take any questions, Chris.
Just I think you're spot on in that my concern with the hub and spoke or doorway is that they got a chunk of money, 48 to 50 some odd $1 million over 2 years, whatever it was. It goes away. So those spokes aren't very strong in theory because if the revenue goes away, and you've got two like bodies doing similar work. Is there a conversation with Myers, Commissioner Myers, to see if the hub and spokes or the doorway can come under the IDN? Because we're already developed. We're about, as a structure, we're down the road compared to where they are. There's a lot of good work being done.
Yeah, I think that is a big risk, and from the very beginning, when we started to hear about the doorway program, we kept going to the back of the room saying, wait, what about the IDNs, where does it fit in? Explicitly now, when we go to the IDN meetings, they're talking about how do we bring these programs, and including the public health networks as well, how do we bring these programs together? And so there is that talk, but that's talk, Chris, and we've got to get from talk to actual planning. It is happening. I think you're going to talk a little bit about, no, there is, no, this is secret, we can't talk. We don't have secrets. There is really concentrated discussions now talking about what happens on December 31st, 2020. That's the end of our funding in the IDN. It's also exactly the same time that the doorway funding ends. So we are all about sustainability, and we've got to sustain together because these are big programs that can't live on their own.
And one of my commissioners said this morning, I focus on finance a lot, and he's right. And because I get concerned, because all this hard work that we're putting in that's making a difference could go away like that. And in Cheshire County, I can speak to that. I've said this before. We're looking at how do we, at least in Cheshire County, if the IDNs go away, continue to fund the programming that's already in place. If those monies are going to continue to flow in, but at the same time, on the hub and spoke side, can we take the politics out of it? I know it's the governor's baby, but can we bring it together and show that it makes more sense to continue the funding of the IDN somehow because you're folding this in with it too?
Amen. I agree, and that's why when we have these meetings for our IDN, we have our doorways people with us. We may end up having to do this just with us together in the room and not ask for a solution from Concord. I think it's going to be from us doing it together and doing the right thing for our patients, regardless of which program they touched first.
Can I just talk to Chris's point? Is there any discussions about sustainability?
Always. Always. We don't have the answers yet, but there is a lot of, we've really now focused, actually our focus needs to be on performance intensely, with the second piece of how do we achieve our performance now and how will we sustain after this funding ends. But yes, this is constantly part of our discussions. I don't have an answer yet. There are many different things that are being discussed.
And Gary, from our standpoint, the counties, or Cheshire County, we're constantly talking about this because even though the city of Keene makes it think like we're not, we're a rural area, we're co-ops, we just have more infrastructure and things, but, so we're constantly saying, we don't have some of this, where does it go? How do we serve people? So it is a concern.
And I'll just end by saying, Chris, your leadership has been really inspiring about how you have brought the county commissioners together to understand the problem. Derek, thanks to you, Sullivan County has really, I think the understanding of what this means has really improved as well. And I think looking to our civic leaders, we're gonna need your help and your leadership to find a sustainable path forward. Good. Thank you very much.